Well, I'm going to talk a little bit about dementias here. There's many of them. There's 5 major ones that occur more frequently. All this is in the book Epigenetics, The Death of the Genetic Theory of Disease Transmission. Certainly, there's not a single dementia that is genetically transmitted, although the medical system and the government would tell you that's not the case, that genetics plays a big part in dementia. Is not true. And so let's look at vascular dementia. Vascular dementia is caused by inflammation of the cerebral arteries, the brainstem arteries, any arteries in the brain. They get plugged by the same things that plug your arteries in your eye, giving you glaucoma, and your arteries in your heart, which give you coronary artery disease, or plug arteries in your kidneys, which give you kidney failure. Okay, put you on dialysis and put you on the list for kidney transplant. This is called vascular dementia, extremely common cause of dementia. Not enough oxygen, not enough food getting to the brain, so you're putting your keys in the refrigerator and forgetting where you parked your car and all that kind of stuff. And very simple to deal with. And we'll talk about that in a second, because I like to deal with all these major dementias at the same time. And then there's Korsakoff syndrome. Now, Korsakoff syndrome we've known about, for hundreds of years. We've known about this since the 1700s, over 300 years, and maybe longer than that. It's actually a deficiency of a single vitamin. We've known that since 1742. It was discovered by the cause of Korsakoff syndrome was discovered by a Japanese naval surgeon in 1742. And then there's Wernicke-Korsakoff's, which is Korsakoff syndrome, which looks exactly like Alzheimer's disease, the deficiency of the single vitamin, but it also has a multiple sclerosis piece added to it. So it's both the deficiency of this vitamin and MS associated together. And then there's B12 deficiency dementia, obviously caused by vitamin B12 deficiency. And then Alzheimer's disease, which is the big daddy from the standpoint of cost. Almost all doctors will call all dementias Alzheimer's disease because in their code book for getting paid by insurance companies, they get paid more for Alzheimer's disease than they do the other dementias. So no matter which one or which combination, and there's no law that says you can't have all 5 of these dementias at the same time, or 4 of them, or 3 of them, or 2 of them. And so, but they call everything Alzheimer's disease because that's how doctors get paid the most. Well, Alzheimer's disease is a physician-caused disease. It certainly did not exist as Alzheimer's disease 44 years ago, even by another name. Today it's number 4 killer of adults over the age of 65, and it's become the reason why so many medical doctors buy and invest in nursing homes, hospices, and so forth, because they know that there's an epidemic coming. There's 80 million baby boomers coming along who did exactly the doctor said. They didn't take vitamins and minerals. They avoided cholesterol-containing foods. They avoided things that will prevent Alzheimer's disease by as much as 80%. Big double-blind randomized study by the medical school, in Johns Hopkins. This came out in 2004. And then, you got to eat 6 to 8 eggs a day. You got to supplement with all the known essential nutrients. And Alzheimer's disease is certainly, you can ameliorate it. In other words, you can make it better when you have advanced Alzheimer's disease by supplementing and avoiding the bad things. And if you take all the good things before you get Alzheimer's disease, you reduce the risk by that one study by 80%. So come on, why not do all these things? Well, I want you to get a hold of the book, Epigenetics, The Death of the Genetic Theory of Disease Transmission, and you'll be amazed, because I just gave you some superficial things. I like to do all of them together. I've had people who were diagnosed with Alzheimer's disease for 8 years by 3 major, well-respected, international and nationally known neurological clinics, and in just 5 days, on a program that directed itself towards all these different types of dementias at the same time, in 5 days, they got out of a fetal position, totally without any ability to communicate, got dressed, put their tie on, and went back to work in just 5 days of the program, And so you can get spectacular results here, and that was in North Carolina, We're not talking about some third world country where you can't trust the records. And so this is something we can all pay attention to. And again, get a hold of that book, Epigenetics, The Death of the Genetic Theory of Disease Transmission, and look up dementias, look up Alzheimer's disease, and you'll be amazed at what you can do to reduce your risk, to prevent, to show a serious increase in function even after you've gone many years with a diagnosis of Alzheimer's disease or other dementias, and you're really losing it. It's amazing how much you can get to come back, the faculties of your brain to come back, memory and so on. And it's all nutritional. You got to avoid the bad stuff. You have to take in the good stuff dietarily to give your brain what it needs to rebuild itself. Yeah, your brain can rebuild itself, but that's one of those failed medical theories that your brain cannot renew itself. That's absolutely caca. That's a scientific term, caca. And, of course, you do need to take a supplemental program to support and promote maintenance repair of the neurological system, the chemistry of the brain, and so forth. It is amazing what you can do when you give your brain everything it needs to maximize your genetic potential for brain function, including memory and cognition, problem solving. Well, stick with us. We'll be back with more Truth, Justice, and the Youngevity Way on Dead Doctors Don't Lie after these messages. Okay, Doug, what pearls of wisdom do you have for us today?
Well, this one's one that people should take heed of, because there's a headline story from the New York Post that's headlined, "Over-the-Counter Pills Could Raise Risk of Alzheimer's."
Well, there you go.
And what they're talking about is anti-allergy medications like Benadryl, and also some like hay fever type pills, and also some older antidepressants. I say sleep remedy, Nytol, anti-allergy meds, Benadryl and Piriton, and some older antidepressants are among products associated with an increased risk of dementia. Say the drugs affect the brain by blocking acetylcholine, a key chemical messenger. The risk of dementia was the highest when these so-called anticholinergic drugs were taken in high doses over several years. According to the lead researcher here, Professor Shelley Gray of the University of Washington School of Pharmacy, says healthcare providers should regularly review their older patients' drug regimens, including over-the-counter medications. Say the connection between these drugs and mental impairment among the elderly was shown in research last year. This was all published in the Journal of the American Medical Association Internal Medicine. And for the study, what they did was they looked at over 3,400 men and women over the age of 65, monitored them for 7 years as they used these type of drugs. And of that group, 637 developed Alzheimer's disease, 160 others were affected by other types of dementia. They say the risk of dementia was 54% higher for those who took the highest doses of these drugs and compared to those who took none. And the risk for Alzheimer's was 63% greater. They say the higher risk of dementia was seen in those who took at least 10 milligrams of antidepressant doxepin, 4 milligrams a day of diphenylhydrine, which is in Nytol and Benadryl, or 5 milligrams of oxybutynin or ditropin, and that's used for overactive bladder for at least 3 years. So these drugs that people seem to think are just, I know people that pop Benadryl at the, drop of the hat, and, any kind of drug, whether it's over-the-counter or prescription, they all have side effects, and people need to be aware of that.
You're exactly right, Doug, and thank you for bringing this one up. And, of course, it tells you immediately that it's not genetic. If you can reduce your risk of a disease by stopping taking an over-the-counter medication, it's not genetic. There's no way you can affect how a genetic disease manifests itself by not taking over-the-counter medication or prescription medication. This tells you immediately it's not genetic. These things do inhibit the chemistry in the brain as well as chemistry all over the body. And you have to appreciate that everything the FDA approves, every drug, whether it's over-the-counter prescription medication that the FDA approves, all of them have a side effect of death. And so I find it kind of funny that people are so worried about the side effects of vitamins and minerals, which are essential nutrients your body requires, and they don't really pay attention to the over-the-counter stuff. But, of course, they're looking now. This was a big story in the USA Today just last year. It said that they're expecting a epidemic of Alzheimer's disease. They use the word specifically Alzheimer's disease. They're expecting an epidemic of Alzheimer's disease by 2050. They're looking for 1 out of 3 people in America to have Alzheimer's disease. This is of all ages, doesn't matter. And, of course, and this is something you can do, is not take these over-the-counter drugs, as you mentioned. And there's all kinds of ways. You have to appreciate that everything that goes on in your brain, whether it's depression, manic depression, bipolar disease, schizophrenia, psychoses, anxiety attacks, panic attacks, ADD, ADHD, autism, all of these things are caused by nutritional deficiencies of the brain. So why not try, the 90 essential nutrients first, give your brain everything it needs, and for a guide, get a hold of the book, Epigenetics, The Death of the Genetic Theory of Disease Transmission. Thank you for bringing this one up, and that's about as new as you can get. Thank you for that study. We'll be back with Dead Doctors Don't Lie for these messages. Okay, Doug, let's go to callers.
Let's head to Arizona, and Renee, you're on with Dr. Wallach.
Hello, Renee, you're on the air.
Hey, Dr. Wallach. Good talking to you.
Well, thank you.
I have an aunt that's 100 years old. She weighs 100 pounds, and her appetite, she doesn't have any appetite anymore, and every time she eats, everything just goes right through her. She's been on the products, the digestion and brain pack. She's gluten-free, and she just really is eating soft foods, and I'm just trying to figure out what can I do extra to help her.
Okay. Well, I would definitely be sure you add to that program, which sounds very, very good. Okay. I would also add the de-stress capsules for the B vitamins for it supports appetite. It's good for the metabolism of the brain and the liver and the heart and so on. So if she weighs 100 pounds, I'd give her 2 of those twice a day. That'll be 1 bottle a month of the de-stress capsules, capital D like David, dash stress, and then give her everything you're already giving her. But things are going right through her. Make sure she's getting very high-quality protein, things like eggs, poached eggs, soft scrambled and butter eggs. 100 pounds, she could eat 6 or 8 of those a day. So a lot of people, when they're that age and their teeth aren't there, and they're picky eaters and don't feel good, you might try taking and making our protein drink, or Slender FX protein, with heavy whipping cream instead of water, and then throwing 4 to 6 eggs in there, and whipping it up real good, and freezing it, making ice cream out of it, and let her nibble on, like a tablespoon of ice cream, and then an hour later give it another tablespoon of ice cream, and so on. And, kind of give her little bits over a period of time as opposed to trying to get her to eat a whole meal. And, of course, I would definitely give up the gluten. You're on the right track there. Make sure that everybody else in the household is gluten-free. That includes the dog and the cat and the bird and the fish and all that kind of stuff. Very, very important. But, we've had lots of people who are over 100 years old. I think the oldest one that we know about we were working with was 102. And they do very well on a regimen like this. The nutrients are required, whether you're just conceived, just one duplication of the sperm in the egg, you're a zygote, or you're 100 years old. So you still need the 90 essential nutrients. So you have to find some way to get it into them, and usually small amounts regularly over periods of time seem to work better than 2 or 3 standard meals. And so I would go that direction. Give us a call every couple of weeks. Let us know how this aunt is doing, because we want to keep her going to 200. We'll be back after these messages. Doug, let's go to callers.
Well, let's head to Austin, Texas, and Tom, you're on with Dr. Wallach.
Tom, you're on the air.
Oh, thank you, Doc. Hey, thank you very much for all you do. First of all, man, I'll
very
tell you, you saved me from 2 spine surgeries, and I've got friends who had hepatitis C. They can't find it, and diabetes, and other friends. It's just wonderful. Thank you so much for all you do.
Well, you're very welcome, sir.
I had actually I had 3 questions, but then listening to the show here, when you started the show, you're talking about don't take the negative side effects of allergy medicine.
Mm-hmm.
Here in Texas, cedar fever is just miserable for a lot of people, me included. And if I don't take that kind of stuff, I've given myself walking pneumonia because the symptoms got so bad that one thing led to another. Mm-hmm. Is there anything you can recommend for that?
Well, absolutely. We do have what we call CM Plus capsules. It gives you anti-inflammatory effects, plus analgesia, pain relief, as well as anti-inflammatory stuff. You could go ahead and use the called multi-EFAs. It's made from evening primrose oil and helps support optimal bronchial dilation, get the bronchi open up, and so you can get the mucus and dirty stuff out. Also, you can actually use some of our stuff that supports the immune system, our glutathione. Okay, it's a great product from our great new family member. Okay, Restart Your Life. just go ahead and use some of that. You can also use the Oxybody is a great one. You can take 1 ounce a day per 100 pounds of body weight of the Oxybody. It's an oxygen supplement. And so I'd kind of try those kind of things as opposed to going with these over-the-counter antihistamines, because as Doug pointed out, those things actually contribute to dementias.
Right. And the other question I had was, I hope I'm not kidding myself or shooting myself in the foot. I'm avoiding burnt foods and, burnt fats or burnt anything.
Mm-hmm.
But here in Texas, I love my barbecue. So what I'll do is I'll go to the barbecue place and I'll get the, like the marbled brisket. I'll have them remove all the black stuff, all the outer coating of the barbecue. Am I kidding myself doing that? Being that it's kind of burnt on the outside, even though the inside is...
Well, you're reducing the risk, but not completely eliminate it. What I do, and I love barbecue, coming from Missouri, in the central part of the United States, what I do is I have a stainless steel cookie sheet, and I put that on the barbecue, where I use, hickory wood chips and charcoal and so forth, and I have a cover for the barbecue pit. And what I'll do is I'll put this coarse salt on the stainless steel cookie sheet, put my ribs or steak or burgers on, or chicken, whatever it is I'm going to barbecue, on that stainless steel cookie sheet, and then I close the top. And so you're going to get the flavor of the hickory wood chips and smoked effect, but you're not going to get the flames hitting the meat. As you want to avoid the flames hitting the meat and burning the fat, because it turns into heterocyclamines and acrylamides, which increase your risk of cancer significantly. So that's what I do to keep my barbecue in my life, but yet stay away from burnt meats. Good question. And we'll be back with more Truth, Justice, and the Youngevity Way on Dead Doctors Don't Lie for these messages. Okay, Doug, let's go to callers.
Let's head to California. And Michael, you're on with Dr. Wallach.
Well, Michael, you're on the air.
Hello, Dr. Wallach. Good afternoon. How are you?
Fine, sir. How can we help you?
Well, I had spoken with you 2 weeks ago, and you gave me a regimen for the rheumatoid arthritis, and I needed to let you know I got the killer biotic. I just started it yesterday. No minocycline, but I need a replacement for the Gluco Gel because I have a food restriction for the shellfish. What would be the best replacement for me?
Okay, you can actually get the Beyond OsteoFX Plus, which is our liquid minerals and calcium without the shellfish, but it does have glucosamine in it, which actually comes from beef skin, okay? Yeah. And you can also use the Fucoid Z, which is a substance from the red marine algae, the fucoidin, which your body can use as raw materials to support and promote maintenance repair, cartilage, ligaments, tendons, connective tissue, disc between the vertebrae.
Okay.
Okay. Keep us informed, Michael. Hey, appreciate all the good testimony.
Absolutely. I'm looking forward to getting better.
Okay. God bless you, sir. Okay, Doug, let's go to caller.
All right, let's head to Alabama. And Rhonda, you're on with Dr. Wallach.
Rhonda, you're on the air.
Hi, Dr. Wallach. How you doing?
Okay, thank you. How can we help you?
Listen, I'm trying to help my sister-in-law who's been suffering with Parkinson's. I have her on the Healthy Heart and Brain Pack. I have her on the liquid minerals. I have her on the Smart and the Selenium. And I want to make sure I'm doing the right thing. Can you give me a regimen for her, please?
Okay, well, it sounds like you're on the right regimen, but the diet is not quite equally important, but it's very important. Shar, what would you do for somebody with Parkinson's disease? You've seen people with really severe Parkinson's disease in 3 months' time become completely normal, haven't you?
Yes, I have.
And what town was it in?
Moose Jaw, Canada.
Yeah, kind of a strange place, right?
Yep.
And this guy, David Dietrichs was his name, and he is very, very ill with advanced Parkinson's disease. In 3 months' time, we go back there for kind of a follow-up event, and by golly, he comes in perfectly normal. And so what was the dietary change? What did we do for him dietarily in addition to these nutritional programs that Rhonda mentioned?
He ate about 10 to 12 eggs a day.
Yeah, and he weighed 260 pounds. He's a big guy, and he was eating 12, actually more than that, but 12 plus eggs a day. And he commented that he had depleted the chicken population in Canada. He's eating so many eggs.
Yep.
And what other dietary restriction would you give him?
No margarine, no burnt animal fat, no meat with nitrates or nitrites, and no gluten.
No gluten, exactly right. No burnt meats. Animal fat's okay, cooked medium rare, or even boiled or roasted if the fat is white and not burned or severely browned. But absolutely no burnt meats, absolutely. And you're exactly right. When it comes to the oils, those are the worst possible things like Ensure, any of these canned meal replacers where they're 40% oil. Another place I find hidden oils is in hotels and restaurants when you order scrambled eggs. I always get my eggs poached because of that. Because you ask them, are these scrambled eggs, are they from a carton or a plastic bag? And they'll say, oh, they're from a plastic bag. Well, they're 60% oil, 20% powdered eggs, and 20% wheat flour. So you got two very bad things in there, the wheat flour and the oils. So you got to really watch what these people are eating. But, with the dietary restrictions, the 12 or more eggs a day, I'd say 6 eggs per 100 pounds of body weight. And again, soft scrambled butter, poached, soft-boiled with soft yolks. And then everything you're giving them now, the Healthy Brain and Heart Pack, wouldn't hurt to throw in the de-stress capsules for brain metabolism, and the Smart FX for neurons to make neurotransmitters. It's a raw material, the DHAs and EPAs, and the Ultimate Dailies to increase and support circulation and so forth. So give us a call every couple of weeks, Rhonda, and let us know how this sister-in-law is doing. Okay, Doug, let's go to callers.
Well, let's head to California. And Madeline, you're on with Dr. Wallach.
Well, Madeline, you're on the air.
Oh, thank you. I have a question.
Yes, ma'am.
My niece has come down with her rheumatoid arthritis again, and she's going to be 12 next month. So I don't know what advice.
What does she weigh?
Well, she's very slender. So I really don't know what she weighs.
Is she bigger than you or smaller than you?
Weigh.
Is she bigger than you or smaller than you?
She's tall and slender for 12.
Okay, well, let's say 100 pounds, give or take.
Okay, yeah.
Okay, 100 pounds. And, Shar, what would you do for this kid who has rheumatoid arthritis, which is not unusual, called juvenile rheumatoid arthritis? What would you do for her?
Oh, I would get her on the healthy brain and heart pack, and I'd give her the extra killer biotic to get rid of it.
Okay, the killer biotic to support the immune system and also to have antimicrobial properties, because rheumatoid arthritis has two pieces. Number one, an infection with a bug called mycoplasma. And it's a very interesting bug. It has properties of a virus that uses your DNA and RNA to replicate itself. And it has properties of a bacteria in that you can kill it with antibiotics and herbs. And so, yeah, you're exactly right. I like the killer biotic or the minocycline, which is tetracycline family, or both. Okay. Then also, I would give her, as Shar said, the Healthy Brain and Heart Pack for the selenium, which is good for the immune system. So 100 pounds, give her one Healthy Brain and Heart Pack. But I get her another bottle of selenium so she could have 6 of those a day, 2 at breakfast, 2 at lunch, 2 at dinner. And if they won't let her take those capsules to school, she could have 2 at breakfast, 2 after school, and 2 at dinner time. And I would also give her the Immortalium. And this is I'd have her take 2 of those twice a day. It's 1 bottle a month to support the immune system, to support the production of stem cells to help regrow things. And it wouldn't hurt to throw in the Gluco Gel. How much Gluco Gel would you give a 100-year-old kid, Shar?
Personally, I weigh a little over 100 pounds, and I take 12 a day.
Okay, well, there you go. Have her take 3 times a day of the Gluco Gel, or 6 ounces of the Gluco Gel liquid a day, whichever is more acceptable to her. And again, that's the raw materials to support and promote maintenance and repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone matrix, bone itself. And give us a call every couple of weeks, Madeline, and let us know how she's doing, okay?
Hey, thank you so much. That was very helpful.
Well, you're very welcome.
All about this.
Okay, thank you. Yeah, these kids, it's not unusual to get rheumatoid arthritis in kids because the bug that causes it, mycoplasma, is a respiratory bug. And so when it gets into the blood system, though, it likes to set up in the joints. Okay, how much time we got here, Doug?
About 2 seconds.
Okay, well, we're waiting for the information moment here. Be sure, everybody, get my new book, Epigenetics, The Death of the Genetic Theory of Disease Transmission, and learn how to deal with over 900 different diseases with nutrition. We'll be back after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Youngevity and 90 for Life Crusade. And Doug, let's go to callers.
Well, let's head to California. And Robin, you're on with Dr. Wallach.
Robin, you're on the air.
Hi, Dr. Wallach. I'm calling you about a pet monkey for a friend. It's a Wawa or Awa monkey. It's about 7 pounds, 4 years old, and it gets a seizure about once a month that lasts for 3 to 5 minutes. It screams in pain before it gets this seizure, and they're wondering what to do.
Okay. Certainly I would change its food. I would make sure that it gets a commercial laboratory monkey chow biscuit, and they have them for small primates and medium-sized primates, and so I'd go get the monkey pellet that's made for a small monkey under 10 pounds of body weight. And then it wouldn't hurt to also give this monkey some alfalfa pellets that were made for rabbits. Just a couple of tablespoons of those twice a day. Let them play around with it and eat some of that. And also I would give that monkey some canned dog food that is gluten-free, no grain in it, just absolutely no gluten. Okay, give it a tablespoon of that canned dog food that has like chicken and red meat and stuff like that in it, no grains. Another tablespoon of that a day. Let's see what the monkey does with that. And then it doesn't hurt to give that monkey small eggs. You can go to Oriental food stores and get some quail eggs and some small banty chicken eggs and things. And I'd go ahead and hard-boil one of those eggs, too, and give that a small hard-boiled egg to that monkey every day. And get a bigger variety of food in there. And then I would give it the minerals, or plant minerals. I'd go ahead and put an ounce of the plant minerals in the quart of water that you're going to be giving that monkey to drink. And let's see here. I would also give it the EFA omega-3s, and I would do that with the multi-EFAs, which is from evening primrose oil, and I would give it 1 or 2 of those a day. And if it doesn't eat them himself, they like to pick those little round pea-sized things up and put them in their mouth and eat them. If they don't, you can puncture the actual little EFA soft gel capsule and squirt it onto the food that he's eating most of. That should cover the territory. Okay, Doug, how much time we have here?
You got about 90 seconds.
90 seconds. Shar?
Yeah.
Say something profound to our audience. Help them live longer in 90 seconds. You got to go quick.
Well, the first thing is to stay away from doctors, and whatever they tell you to do exactly 180 degrees different, you'll be better off. And get on a gluten-free diet, take your minerals every day, take your 90 for life every day, and that will be the best thing to guarantee that you can get to 200.
Absolutely, exactly. When a doctor says he needs to cut your arm off, I get another opinion. People get five quotes to get a roof put on their house and a sprinkler system put in. Whatever their doctor says, they just do it. Get second opinions, get third opinions. Do your own laboratory test. Get a hold of that trilogy books, Let's Play Doctor, Let's Play Herbal Doctor, and Passport to Aromatherapy, and do your own laboratory test. Char's exactly right. Do as much as you can yourself. Always take the 90 for life, and do that one healthy start pack for 100 pounds of body weight. Gives you all the known essential nutrients, 16 minerals, 16 vitamins, 12 essential amino acids, 3 essential fatty acids, and it'll even reduce the risk of birth defects in young couples that are going to start having a family. Right? All birth defects are caused by nutritional deficiencies of the embryo, not genetically transmitted. Why hope and pray on the throw of a dice what nutrients may or may not be in your food? Give presents of the 90 essential nutrients for birthdays, anniversaries, Christmas, anytime there's going to be some reason, graduation from college, people going on vacations. Give them the 90 essential nutrients. Make sure everybody's going to get their 90 essential nutrients. and we'll be a healthier America. Well, thank you so much, Shar. Super job as usual. Thank you so much, Doug and Richard. Superlative job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.